Okay, so this is the V60 Bipap that we use here at my clinical site. This one is set up for heated humidity. So it gets plugged into the red outlet, so it's backed up to the generator, and it also uses oxygen. You can use wall oxygen in your patient's room, or there's two e-cylinders you can see with a regulator that you can use for transport as well. I'm not going to use oxygen for my video, but just know that there would be oxygen used. So this is the pressure, and then this is what's going to go to the heated humidity to get that to the patient. So there's a little spike right here that we use to spike sterile water for oral inhalation. That water will fill this little chamber, and then it's attached to another part of this blue corrugated tubing, which does have heated coils in it. You can sort of see maybe. So we have a temperature probe here on this end, and then we're going to also have a temperature probe here on the patient side as well. So here's our temperature probe. This is the pressure. We have an exhalation port. This is what's going to attach to our patient's mask, and you can also do inline nebulizers through this as well. So to use the Bipap system, go ahead and turn it on. And it's going to alarm because I don't have it on oxygen. So as you can see, we're getting waveforms for our pressure. Pressure's higher on inspiration than it is on expiration, and our volumes. We have our IPAP. Normal IPAP is 8 to 20 centimeters of water pressure. We also have our respiratory rate, which is between 8 and 12 to 20 breaths per minute. Our inspiratory time should be between 0.8 and 1.2 seconds. We also have a rise time. Our ramp you can use for patient comfort. That determines how fast your patient's going to get to their IPAP. EPAP should usually be between 4 and 15 centimeters of water pressure, and there should be a pressure support of at least 4 between your IPAP and EPAP. And then you have your oxygen level. So you can set the FiO2 anywhere between 21%, which is room air, or 100% full oxygen. So to change any of these parameters, all you do is click them, and then you have an arrow on either side. So you just adjust accordingly, and then once you've chosen the setting that you want, you just click accept. So that's how you change any of these settings. Now this particular type of ventilator, or this particular type of Bipap, can also be used in CPAP mode, which is just the one constant pressure throughout inspiration and expiration, and it could also be used in AVAPS mode. So it's kind of a multi-purpose type of machine. So just so you can kind of see the difference between the IPAP and EPAP, I'm going to push my finger here. Okay, so you can see now that's exhalation. There's still pressure and there's inspiration. So there's less pressure on expiration, but there still is that pressure. So that is the basics on how you use this V60 for Bipap.